How can I whiten my teeth? Do you recommend whitening? What do you recommend for whitening? And this is how it's gonna go. My name is Dr. Joy. I'm a general dentist and I've been practicing for 3 whole years. Today I'm going to be giving tips for the patient. So if you are here because it said whitening and you're interested in teeth whitening, hello, welcome. So we're going to go through a few ways to whiten your teeth. And I get lots of questions. People are always like, how can I whiten my teeth? Do you recommend whitening? What do you recommend for whitening? And this is how it's going to go. So we're going to have a 2-parter, okay? The first part is going to be 1, I just think everyone needs to go visit their dentist. If you are avoiding the dentist because you're scared of bad news, I have some bad news for you. The longer you wait, the worse it's going to get. So go ahead, call, make that appointment. If your dentist shames you or makes you feel like, you know, they're talking down at you, then find a new dentist, because your dentist should be encouraging and helpful and an advocate for you. Next, the thing is, a lot of people will come to me and they're like, I need teeth whitening. I think like these stains are just not coming off. And I'm like, I hear you, yes, but let me clean your teeth and then I'll show you the result and you tell me if you still want teeth whitening, because we can still do that for you. But let me clean your teeth first and then we can talk. And 9 times out of 10, I've done the cleaning, I've done all the things, I've checked it, I've checked my work, they've seen it and they're like, oh wow, you're right. And I'm like, yes, I love when you say that. So that is tip number 1, go get a cleaning. And if you haven't been in a few years and your dentist is like, you need a deep cleaning, I just need you to you can go get a second opinion if you want, but probably just take their word for it. Also on the x-ray, if they recommend a deep cleaning and they show you the x-ray and they're like, yeah, but you should see like an x-ray with spikes coming out of the teeth. I'll show you what that looks like. Okay, so that is tip number 1, go get your teeth cleaned. And deep cleanings, I like to do them in 2 parts. So numb half the mouth, do the top and the bottom, and then the patient comes back another day, I numb the mouth, I do the top and the bottom on the other side. The reason I like to do it this way is because 1, I hate to numb the whole lower jaw. That is a really uncomfortable feeling for patients. The whole tongue is numb, and it's like that for a few hours. I don't want to do that to y'all. And the other part is I like to do half so that patients can physically see and feel the difference of that cleaning, okay? I want to do half mouth stop right here so that when you look in the mirror, you can see how red and puffy the gums are on one side and how healed and healthy they look on the other. Now, for the second part of the video, if you are the patient who goes to the dentist every 6 months, or at least once a year, I really recommend twice a year, okay? But if you go once a year, that's better than nothing at all, and I'll take it. If you go to the dentist twice a year and you still feel like you need whitening and you're not getting the results you want, you can always do stuff at home, which I typically recommend because the stuff we have in the office, it is a higher concentration of what you can get at the store. With that higher concentration, you get fast results, but you also have an increased chance of getting hypersensitivity. So that means having sensitive teeth to cold and air and all those things. And we want to avoid that at all costs. So one thing we have is opalescence. That's in office. We're going to make you trays. We're going to send you home with a solution and you put it in your teeth at night, and then yes. But sometimes it can burn the gums. Sometimes it causes a lot of sensitivity. That is an option. The next option would be white strips, Crest or Luminex. I've heard that Luminex works really well. I've heard that from another dentist. And then Crest white strips, I've used them myself and they do work really well. The thing with these white strips is that they want you to pull it out and then fold it like a hot dog and then put it on your teeth. But who's looking at the back of your teeth? Should only be your dentist, not even you. Like, you can't even see the back of your own teeth. So cut those in half. They will last twice as long that way. Put them on there. And you should really do it like 3 times a week to get started. And then after a week or 2, you can just go to once a week for maintenance. You should see a big difference. When it comes to toothpaste and mouthwashes, I don't think mouthwashes do any teeth whitening. That stuff doesn't stay on your teeth long enough to do anything. And then as for the toothpaste, the whitening toothpaste, they contain abrasives that help get off stains, but it also can damage your teeth. So I don't really recommend those. You should floss every single night and you should brush twice a day. If you don't brush your teeth before bed, you are asking for trouble. You're asking for cavities, all the bad things that happen to your teeth. They are increased by like a bajillion times at night. So please, please, please brush your teeth at night, floss at night. That is the most important time to do your routine. As for whitening, I think that's it. Oh, also those things you can get at home where you like paint it on and get the little light. I think those do work. I just don't know about any science behind it. But the things I do recommend, they will be linked below. Oh, and then the other thing is that if you're gonna do whitening and you still have a lot of sensitivity, either get Sensodyne, or if you're visiting your dentist soon, ask them for a Prevident prescription. It is a prescription toothpaste with extra fluoride in it. It helps prevent cavities and it helps decrease sensitivity. So that is usually the spiel I give my patients, like at home strips and brushing and flossing and visiting the dentist every 6 months. So that's it. I hope you learned something. If you did, hit that subscribe button, like the video, and share with a friend if you think they might have some questions. My biggest piece of advice is to stop taking advice from TikTok gurus. You cannot get your dental advice from TikTok. Go to your dentist. Let them look at your mouth, okay? I need you to go visit your dentist. Bye, y'all.